investing in women's health would not only improve billions of individual lives, but also provide a revolutionary boon for economies around the world.
Welcome to Healthcare Perspectives, a podcast by Siemens Healthineers about medical breakthroughs with the power to improve lives everywhere. You've just heard Shyam Bishen, head of the Center for Health and Healthcare at the World Economic Forum and board member of the Global Alliance for Women's Health, explaining the invaluable benefits of investing in equitable healthcare. In this episode, Elisabeth Staudinger, member of the Managing Board of Siemens Healthineers, is joined by Shyam Bishen and Nadia, Fettah, Minister of Economy and Finance for the Government of Morocco.
Hello, I'm Elisabeth Staudinger. With significant disparities in diagnosis, treatment, and funding when compared to men, women's health has long been underserved. These gaps affect not only individual health outcomes, they also have societal and economic implications that are further highlighted by a recent report by the World Economic Forum and the McKinsey Health Institute, which addresses a $1 trillion opportunity to improve lives and economies by mitigating these disparities. Factors like societal perception, clinical practice, and financial investment all play an important part in women's health. It's everyone's job to help women rise. In this episode, I'm joined by two of my fellow board members of the World Economic Forum's Global Alliance for Women's Health. Today, we discuss how building a more equitable healthcare system can drive meaningful change, improve healthcare for women, and create access to significant economic potential worldwide.
Worldwide, 40% of labor force is women. And in sub-Saharan Africa, where we still rely a lot on agriculture, women represent 60% of the labor in the rural world. So having healthy women helps to push for more inclusion. Even in developed countries, we invest a lot on educating girls, but because they can suffer, I wouldn't say just disease, but endometriosis and others, they're leaving school too early, despite the governments are paying a lot for their education. So investing in healthcare is allowing for women not to get married too early, to have a job, and to remain in this job. And of course, it gives also balance in the family, in the community, and especially in the poorest countries. We know how the cell of the family is very important for the trajectory of the social and economic development.
This is Nadia Fettah, Morocco's Minister of Economy and Finance. The mission of an equitable healthcare system for women is not only important globally and for her country, it is also deeply meaningful on a personal scale.
My mother used to have 10 sisters and one brother, so women's condition is very close to my heart. I saw how powerful when women are working together. Really, women's condition has been the story of my life, of my mom's life, and my grandmother's life. On the other hand, I am interested in inclusion of all the population. Unfortunately, women and youth are the ones who don't have the proper advocacy and voice. Now that I'm Minister of Economy, I can see that we will never reach this 5-6% growth that we need for being a real emerging market without women. And of course, to develop, you need skilled, talented, but healthy people, and specifically healthy, skilled, and talented women.
Despite living longer, women spend 25% more time in poor health than men. At the World Economic Forum in Geneva, Shyam sees the incredible disparity when considering the lack of female-specific research for disease.
Currently, healthcare research does not adequately account for relevant sex differences in disease, and sex as a biological variable due to the underrepresentation of women in clinical trials. So that's a serious problem here.
Women's health is indeed underfunded, under-researched, and undervalued. Take prostate cancer, for example, where 1 in 11 men worldwide are at risk of being diagnosed with the disease by the time they turn 70. According to the National Institutes of Health in the United States, in 2023, funding for prostate cancer research amounted to just over $300 million. For endometriosis, a condition that affects 1 in 10 women of reproductive age, that amount was just $29 million. Shyam Bishen shares another example that stands out when discussing healthcare disparities between genders: the heart attack.
Heart disease is the leading cause of death for men and women, and solutions are needed to address this issue urgently for all. However, research shows us that due to a lack of research and gender biases, there are misconceptions in understanding the impacts and symptoms that common conditions such as heart disease can have on women, which are potentially life-threatening most of the time. When it comes to heart disease, women are 7 times more likely than men to have a heart condition or be discharged during a heart attack, and 50% more likely than men to be given an incorrect diagnosis following a heart attack.
And according to research from the University of Leeds, women are twice as likely to be misdiagnosed after a heart attack. A huge hurdle in overcoming this discrepancy has to do with what has been referred to as the Hollywood heart attack, or the stereotypical heart attack experience that is often portrayed in film and television.
What we see in the movies where a middle-aged man gasps, clutches his chest, and falls to the ground may not really reflect the overall reality, especially when women are the victims of the heart attacks, leading to a lack of misdiagnosis of heart attacks or heart disease in women. Diagnostics and disease models that do not reflect or account for women's biologies, such as those for heart diseases, can contribute to delays in diagnosis and care, as well as lower quality treatment decisions even once a woman is within the care system.
On top of misdiagnosis and premature discharge, female cardiac patients are also less likely to be prescribed secondary prevention measures to decrease the risk of further disease. With research, however, many of these issues are surmountable.
This further impacts the framework of diagnostics for heart diseases, leading the misdiagnosis in women after heart attacks. I think it's really important that we address these misconceptions and we conduct more research into how heart disease impacts and manifests in women so that we are much more familiar with the symptoms and we are much more familiar in terms of what to do when you see these symptoms.
And in cases where research has been done, there have been hopeful results.
According to the British Heart Foundation, research shows that when different limits are applied to the troponin test, for example, which is a routine test for a heart attack that measures the level of troponin in your blood, that can be a sign of a heart attack. So troponin test is a key test that we normally use for heart attack. More women receive a correct diagnosis of heart attack when we do this test. Thanks to this research, there is now a better test to diagnose heart attack in women.
As a secondary preventative measure, there are very important signs and symptoms of a female heart attack that women and their loved ones should be aware of.
The common signs of a heart attack in women may be a little different than what you see for men. In addition to the common symptoms of heart attacks, the following are also symptoms of a heart attack in women, such as shortness of breath, nausea, vomiting, back or jaw pain, In addition, according to British Heart Foundation, women could also experience a sudden feeling of anxiety that can feel like a panic attack or a lot of coughing or wheezing. Women often end up associating these symptoms to less life-threatening conditions such as acid reflux, the flu, or normal aging, which is disastrous in case of a heart attack.
But, Shyam Bishen notes, the occurrence of a heart attack doesn't have to be a foregone conclusion for those with risk factors. In fact, when it comes to prevention, education is the biggest key.
Educating the public as well as the healthcare providers on the differences between how heart diseases manifests in and impacts women versus men is essential. The first and most critical step towards achieving this is research and data.
About 1 year ago, I was honored to join the Global Alliance for Women's Health as a founding member. We came together at a global level to work towards collecting comprehensive data in an effort to further close the gender healthcare gap.
When it comes to clinical research, there are several changes that must take place to better address women's health needs. The first, the inclusion of women in clinical trials and disaggregation of data is essential to understanding more about women's health. The second is on the regulatory side. A regulatory focus on gender equality has the potential to drive industry trends for prioritizing investments in conditions specific to women, research strategies that include analysis and consideration of sex and gender in all therapeutic areas, and alternative pathways for producing commercialized products for women. The Global Alliance for Women's Health, in collaboration with key partners, is developing the Women's Health Gap Impact Tracking Platform, which will demonstrate in depth the stats of the women health gap across 9 conditions, including ischemic heart disease. This will be a publicly accessible resource, allowing for the data to be used not only to educate relevant stakeholders, but also influence policy and regulations, impacting a real change in this area.
For Nadia Fettah, a fellow board member of the Global Alliance for Women's Health, another primary focus for a more robust, more equal healthcare system requires equitable access to both providers and adequate funding.
I think that we need women to remain healthy, to have access to doctors. It's a very easy one, but I think we often would say it's social, it's cultural, I'm not sure. But if you put money for prevention through communication, through centers, through associations that really increase the awareness, this is very important. Secondly is to support the underfunded areas. Mental health is also a disease that unfortunately a lot of women suffer from, and I think that nothing is happening actually as a global action for mental health for women, and invest also in infrastructure and access, really build healthcare infrastructure. It costs a lot to countries, but maybe international fundings and international cooperation should be really concentrating a significant part of it on all these areas.
In Morocco, the government has moved towards setting aside funds for gender-specific healthcare research.
We are improving this budgeting process, but putting systematically figures around how much go to women-targeted policies is very important. The other thing I would mention is also public-private partnership, because I think there is global solution when it comes to medicine, innovation in technology, but the way of having a health policy implemented can be very local and very regional. And when you look at the money that is available, I am convinced that this money is there, but channeling the money to the proper processes, persons, association, it would be my priority.
And part of that money, she says, also needs to be allocated to a greater focus on women actually leading the charge for research.
We don't have enough doctors, we don't have enough nurses, but we definitely don't have enough research and people trained for research. In the policies, we should dedicate specifically money to attract and to retain women in a leadership position in the health sector in general. Only 18% women are in charge in the laboratory of the trials for new medicine. But in the teams of these women, you have more than 50%, I would say, trial done on women. So we should also be sure that leadership position, we also have women taking care of this type of funding.
When all is said and done, Nadia Fettah believes that prioritization of funding is the very key to healthcare equality.
Humanity wants to go to the moon or to Mars. I think if you gave us just some of this money, I think it should be very, very useful for healthcare.
Though the healthcare sector has quite a way to go before achieving anything like equality between sexes, there have been tangible success stories when funding and research is focused towards helping women. For Shyam Bishen, one example that stands out is the vaccine for the human papilloma virus.
A woman dies every 2 minutes from cervical cancer. The leading cause here is the HPV, which is human papilloma virus, which causes cervical cancer. HPV vaccine, an outcome of decades of research, has been found to have very high efficacy, almost 100%, with several studies highlighting the incredible impact it has had on preventing cervical cancer in women. One study in Scotland detected 0 cases of cervical cancer among women who were vaccinated for HPV before the age of 14. Funding from the World Bank, Bill and Melinda Gates Foundation, and UNICEF, among other organizations, has been essential in scaling up HPV vaccination and preventing cervical cancer in women. HPV vaccine is an excellent example of how dedicated investment into research in women's health can lead to tangible life-saving improvements in women's health outcomes.
And for Nadia Fettah, it's the statistics behind breast cancer mortality rates and modern birth control that speak loudest.
Breast cancer is a good example because in developed market now mortality has decreased to 4%. But even in Morocco, when today we have really free exams for all women, I can also say that thanks to all the policies on maternal health, now we have 72% of women from 15 to 50 having access to very modern birth control methods. And we have reduced the number of teenage pregnancies significantly.
We see so much investment now starting. We have an initiative from White House on women's health. We have a separate budget at National Institute of Health in the US for women's health research and development. We see so much focus coming from philanthropies. Obviously, there is much more that needs to be done, but I see that there is a lot of hope because we see so much attention that's being paid on the gender parity, which includes women's health gap. So I have a lot to be hopeful for here.
Women are not small men. Worldwide, healthcare's focus has long neglected the unique needs and perspectives of women's health. With a lack of emphasis on nearly 50% of the human population, women have suffered from misdiagnosis, inadequate treatment, and a profound lack of research into diseases that affect them uniquely. But today, more than ever, my fellow board members from the World Economic Forum's Global Alliance for Women's Health and I see major potential for improvement. The answer to these issues must be threefold. The attention must turn to research and innovation, funding, and a change in the global agenda.
Increasing research and innovation into conditions that uniquely, differently, and disproportionately impact women's health is critical to closing the women's health gap. This requires players to participate in the redesigning of the research ecosystem that impacts women's health outcomes. The second area is financing. Funding and investments into women's health is critical to close the gaps in women's health research and development. The third one is setting a global agenda. In order to rewrite the narrative around women's health, emphasizing the transformative impact it has on societies and economies.
We have a lot of index around green energy, how you deal with water waste. Let's put also in the same basket one index that says this country, this company is dedicating efforts for women's health. These categories of green money should also have pink money for women in any public policies. So this is what I would push for, because this money in the meanwhile is sitting elsewhere.
You have been listening to Healthcare Perspectives, a podcast by Siemens Healthineers. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. Subscribe to us and always get the latest episode in your podcast feed. Or visit siemens-healthineers.com/podcast for more. The opinions expressed by the guests and contributors in this podcast are their own and do not necessarily reflect the views of Siemens Healthineers. The statements by Siemens Healthineers customers in this podcast are based on results that were achieved in the customer's unique setting. Because there is no typical hospital or laboratory and many variables exist, for example, hospital size, samples mix, case mix, level of IT, and/or automation adoption, there can be no guarantee that other customers will achieve the same results. This podcast describes possible future ideas and concepts. It is not intended to describe specific performance and/or safety characteristics of currently planned or future products. Future realization and availability cannot be guaranteed.